Pralidoxime, commonly known as 2-Pam, or you might see 2-Pam chloride or Protopam, any of those. It is a cholinesterase reactivator, and it is an antidote for organophosphates poisoning. So it reactivates cholinesterase, therefore allowing destruction of the accumulated acetylcholine at neuromuscular junctions. Once that happens, it reverses respiratory and skeletal paralysis that has occurred. Pregnancy class for it is C. Indications: organophosphate and pesticide poisonings, and then also it can be used for anticholinesterase medication overdoses. Just an example I threw in there of a medication is donepezil. That is an anticholinesterase medication. Contraindications: if you've got respiratory paralysis and someone's not breathing, there's really no true contraindication for it. Something we want to do keep in mind is that we want to reduce our dosing in patients with renal failure, myasthenia gravis, or an inorganic phosphate poisoning, where we don't think it's going to be effective anyways. Adverse reactions could be dizziness, drowsiness, headache, neuromuscular blockade, seizures, laryngospasms, tachycardia, nausea, vomiting, muscle rigidity, and we always got to throw it in there, cardiac arrest. Could cause a rash as well, so there's that. But every one of those except for cardiac arrest is better than being dead due to, respiratory paralysis. So pick your poison, I guess. Drug interactions: we don't want to give it concurrently with morphine or sucks, aminophylline, theophylline, or anything else that's going to depress respiratory drive. It usually goes without saying. Typical adult dosing: 30 milligrams per kilogram IV over 15 to 30 minutes, or it is pretty commonly supplied as a 600 milligram auto-injector that you just give IM. Pediatric dose: 30 milligram per kilogram, again IV on that, or IO I guess. Starts working pretty quick within a minute or two. Peak effects vary and the duration varies, depends on what medication it is counteracting and the concentration of that medication, because they're fighting for that those receptor sites. So something just to keep in mind, if you have protocols for it, you might consider drawing a blood sample prior to administering the medication, just so they can test it at the lab later and find out all that wonderful stuff.